Hello, I'm Dr. David Clark. I have a private practice, restorative practice in Tacoma, Washington. We also have a learning center where we've partnered with 3M and BioClear to teach injection molded composite dentistry. So my practice inspiration for today is Class 2 composite restorations. Just okay is not okay. And we've seen an awful lot of posterior composites that are just okay. They're getting by, but they don't look like porcelain and they don't look like gold. And so what we're going to be doing is taking a little bit of the curriculum from one of our advanced courses at the Learning Center, which is in cuspal overlay for a cracked tooth. And so what I'm showing here is a lingual postoperative view to compare. On the left side, we have a slot preparation that was filled with a burnished metal matrix with sort of a margin-driven approach. And then we have a infinity edge BioClear restoration on the right side. You can see a much more curvaceous emergence profile, a much broader contact, really what we're used to looking like, what it looks like with gold. Now we flip that image around and look from the buccal, you really see the problems inherent with sort of margin-driven burnished metal matrices. And so yeah, the contact is just okay. When you look at the contact on the other side, it's very different. So here's a pre and post-operative radiograph comparing the old slot preparation on the right and then this infinity edge compression-based restoration on the left. And so once again, that's a biofit matrix on the left, a burnished matrix on the right, and then an infinity edge preparation on the left, sort of a boxy prep on the right. And now you see what this additive dentistry looks like. We're adding a tremendous amount of composite to interface with all those enamel rods. And so it's a very different cavity preparation than these traditional ones that we've been doing for a long time. They're sort of based off of amalgam. All right, so what we're going to be doing first is we're going to be talking about the protocol for injection molding and light curing a non-layered restoration. We're moving to monolithic composites just like we moved to monolithic ceramic restorations. They're stronger, they're simpler, and they're simply beautiful. And so when we do injection molding, we first take care of our recently cut dent tubules with a total etch technique. Then we'll massage the Scotch Bond Universal into the dent tubules for a full 20 seconds, air thin and cure, and from that point everything changes. Then we're going to go ahead and apply adhesive a second time as a surfactant, air thin but not light cure, then inject heated flowable, either Filtech Supreme Ultra or Filtech Bulk Fill if it's an anterior or posterior, in this case the bulk fill, and then we don't cure that, and then we push the paste, the Filtech 1, into that complex, and it pushes like a squeegee all of the adhesive and the flowable out the sides. We get this incredible monolithic mass. Some of you are already sort of doing this, but it's very comforting to know that now we have a plan, and 3M has done exhaustive research on the BioClear method showing that yes, you can co-cure all of these three things together. So we use Scotch Bond Universal because it allows us to do a total etch, and if we need to, we can use it as a self-etching mode also. In the anterior, basically in front of the canine, we'll use Filtech Supreme Ultra. It's our go-to composite for monolithic. And then in the posterior, we're going to be using Filtech 1 with the bulk fill flowable. So once again, in front of the canine, we're going to use Filtech Supreme Ultra, both the flowable and paste. And then behind the canine for posteriors, Filtech Bulk Fill Flow and Filtech 1 heated. All right, so let's go. One of the things that allows us to injection mold to an infinity edge is heating of composite. And so one of the neat things with the partnership with BioClear and 3M is they've gone in and done exhaustive research to show that heating of their composites is safe. So don't worry about heating up the composites. It's safe to the pulp. It's safe to the composite. The next thing that really gets in the way of a monolithic restoration is three-point curing. So because the BioClear matrix is translucent, I can begin to wrap over cusp tips around the tooth and not be worried about light curing. So three-point curing is key. We start with 10 seconds curing on the occlusal in a class 2. Once the occlusal is cured, you're going to take the separator off, but leave the clear matrix and the wedge intact, and then do buccal lingual curing. In this slide, you actually see me curing with two curing lights, buccally and lingually, which is fine. You need to have three-point curing if you're going to get to a 5 millimeters depth of cure. The majority of dentists in the United States are still not comfortable with bulk filling. And that's because number one objection that I've heard is that you don't trust the depth of cure claims. So the way to get 5 millimeters depth of cure is it's incredibly helpful to have a clear matrix because we have to do buccolingual curing. And so it's a little bit difficult with the metal matrix. So a metal matrix tends to get in the way. So this LED power is a great light. It's right in the middle of around 1200 milliwatts of power. That's what I want for these restorations. So like I said, at around 1200 milliwatts, that's the sweet spot. I really don't want any more power than that because you can generate so much heat. At the end of the day, 3M recommends a minimum of 10 seconds, 10 seconds, 10 seconds. And so even with a higher power light, the composite still needs to polymerize appropriately. So this is the recipe that we basically have. And the 3M's got a great program where you can come in and check your light. Because the other thing that people worry about is, I don't know if my light can cure through here. So the 3M folks will actually come to your office and make sure your light is in that 1200 milliwatt range so you can do true bulk filling and true injection molding. So that we can all stop worrying about this. So let's go ahead and injection mold a case. This is an interesting case. This is a patient is a friend of mine, and she doesn't have any dental insurance, which made the conversation actually kind of easy. So here she is, and this is Karen, and she's got a molar that's had a composite placed in, and when you put composite in a traditional GV black type of retentive cavity preparation, it doesn't protect the tooth from fracturing. So it's a tension joint. So she's got pain on chewing on this second molar. So the restoration's been in there for about 15 years. The distal lingual cusp has an incomplete fracture. And we're going to go ahead and I explained the options. I said, Nana, I can do a crown or I can do a BioClear overlay. And so the fee for the BioClear overlay, let's say that your crown fee is $1,000. A BioClear overlay would be $700. So that's a range that we give our patients a choice. She chose the more conservative option, and I told her that she really should have about the same amount of longevity. So here we go. So the tooth has been prepared, and these are some of the things that we teach in the classes that we're giving with Seattle Study Club about what the cavity prep looks like, but we're going to be focused on the injection molding. This is a special gauge that we built. It's a probe that's a go, no-go. So in the interproximal, she's in the red zone. So she's at about 6 millimeters. So we are going to have to put a little bit of bulk flow flowable down first over just the margin on in the depth of the interproximal. We'll cure that, and then we get to injection mold the rest of it in a 5 millimeter mass. So here we are. We've got a little bit of flowable on the interproximal. We've also done what we call a curb and a little spot weld to keep the matrix intact. That's why flowable is so great. So we're going to go ahead and sort of tack the matrix in place, put that little 1 millimeter on the interproximal, and now we get to injection mold. I've got this big catcher's mitt that I can injection mold a monolithic mass. So here we go. We go ahead and injection mold. And then I'll go ahead and show you as I'm removing the matrix. You see that beautiful mylar finish. It's a monolithic mass. These things don't look like hand-manipulated composites. And the engineers at 3M said, David, that's because you've maintained the structural and optical integrity of the composite. So they said that this is Filtech 1. This is not an ugly, grainy composite. So we've got a bunch of biases that keep us from doing injection molding with a monolithic mass. We've talked about several of them. We don't trust our curing lights. We don't trust the material. The metal matrix stops the light. And, bulk fills are ugly. Well, none of those things are necessarily true. So here's the final result of a compression joint, and I'm going to show you the cavity outline. So we've got a calla lily. I invite you to learn more about these preps. A calla lily on 3 of the cusps, and then a cuspal overlay on the distal palatal with about 2.5 millimeters of cuspal reduction, and then an infinity edge on the palatal. And these are incredibly comfortable restorations. I want to talk a little bit about the technology in Filtech 1 that's different, that makes it act a lot like a normal composite. It's not ugly like a lot of the old bulk fills that we had. So Filtech 1, I like to say that it has a transitional translucency. In other words, as you cure it, it becomes more opaque. And in Karen's case, you can see that dark dentin, I didn't have to use an opaquer over it, that the Filtech 1 had enough opacity. Most of us don't want to layer and opacify. We like to just keep it simple. So the fact that it's more opaque than a traditional bulk fill allows us to not worry that the tooth is going to look dark. So this is this interesting technology that they put into Filtech 1, where I call it transitional translucency. And so it's very close to their normal opacity. So we don't want a composite that's too translucent. That is not going to help us. So once we've taken care of the dentin adhesion, here's injection molding. We're going to apply the Scotch Bond Universal as an adhesive, as a surfactant. We'll air thin that, but not light cure. And then we're going to pump in the bulk fill flowable, and that displaces the uncured adhesive. And then we push the Filtech 1 in like light body and heavy body impression material, and that displaces all of the lesser resins. And then we have this beautiful monolithic mass, just like we have monolithic with zirconia. and then we sculpt that restoration. And I wanted to show you some follow-ups. The series of images that you see on the top row are cuspal protection cases of a calla lily and a cuspal overlay like you saw in Karen's case. This is a 10-year post-op. So these materials in compression, Filtek Supreme Ultra's got the same wear resistance as enamel. It wears at the same rate as enamel if there's no margin, if it hasn't been hand manipulated. And then a topic for a different day is here's a 6-year post-operative of a black triangle treatment with a monolithic injection molding of regular Filtek Supreme Ultra plus the flowable. So it's neat to watch these cases now that we've been doing it for 15 years, that these post-operatives don't look like old-fashioned bonding. They're holding up a lot like a ceramic. So we have a different value for these outcomes now when they can really last, and then we can really position traditional fillings, indirect with crowns, that's great, but we have a third modality, which is monolithic injection overmolded composite. It's a great option, and there's moments of opportunity to use that throughout your day to really give the kind of dentistry you'd want in your own mouth. And so if you'd like some more information, you can email solutions@bioclearmatrix.com. Like you see on the screen, there's a whole bunch of folders. There's a folder with a bunch of files for Seattle Study Club members with articles, videos, that kind of thing. And you can, of course, email me at drclark@bioclearmatrix.com. Love to chat with you. Come out and visit your chapter, do a hands-on course. Most of all, I want to thank you for your time and thank you for your passion. The members of the Seattle Study Club, I really enjoy working with you all, so talk to you soon.